Let's start with the basics. Medicaid is a government health insurance program designed specifically for low-income Americans. It's not just another line item in the federal budget. For millions of people, it's the difference between getting care and going without. If you've ever wondered how people without much money manage to see a doctor, fill a prescription, or get help in a medical emergency, Medicaid is often the answer. It's a lifeline for those who might otherwise fall through the cracks of our complicated healthcare system. Medicaid is a unique partnership between the federal government and the states. The federal government sets some ground rules and provides funding, but each state gets to tailor its own program. That means eligibility, benefits, and even the name of the program can look a little different depending on where you live. But at its core, Medicaid is meant to be a safety net for the most vulnerable: children, pregnant women, seniors, and people with disabilities. It's the program that steps in when private insurance or Medicare just isn't an option. Think of Medicaid as the public library of healthcare, vital, accessible, and often overlooked. Just like a library, it's open to everyone who qualifies, and it's there when you need it most. You might not notice it if you don't need it, but for those who do, it's absolutely essential. It's a quiet force that keeps communities healthier and more stable. The core idea is simple. If your income is low enough, you qualify. There's no secret handshake or hidden catch, just a straightforward promise that if you're struggling financially, you can get help with your medical bills. It's supposed to be a clear, compassionate system. Medicaid was created to break the vicious cycle where being sick keeps you from working, and not having healthcare keeps you sick. Imagine trying to hold down a job while battling untreated diabetes, or caring for a sick child without being able to afford a doctor's visit. Medicaid is there to make sure illness doesn't push people further into poverty, and that poverty doesn't keep people from getting well. But, as with so many things in America, politics can't leave well enough alone. Medicaid has become a political football, tossed back and forth in debates about budgets, values, and who deserves help. Instead of a straightforward safety net, we get endless arguments about who deserves help and who doesn't. Some see Medicaid as a basic right, while others see it as a privilege that should come with strings attached. Enter work requirements, the controversial idea that you must prove you're a productive member of society to get health care. In some states, this means showing pay stubs, logging job searches, or reporting work hours just to keep your coverage. Supporters say it encourages responsibility, but critics argue it creates more red tape for people who are already struggling. This isn't just a minor tweak to the system. It's a fundamental shift in what Medicaid is supposed to be. Is it a health program, or is it a work program? Should healthcare be a reward for employment, or a basic guarantee for everyone who needs it? That's the fight we're unpacking today. Is Medicaid about health or about work? The answer shapes who gets care, who gets left out, and what kind of country we want to be. Some say work requirements promote personal responsibility and help people move up the economic ladder, but critics warn they're really just a bureaucratic trap, designed to kick people off insurance by making the process so complicated that many give up or get lost in the paperwork. And that's the battle at the heart of Medicaid's future, a fight over who we help, how we help them, and what we believe healthcare should be in America. Before politics complicated things, Medicaid was a straightforward promise from the government to its most vulnerable citizens. It was designed as a safety net, a way to ensure that no one would be denied basic healthcare simply because they couldn't afford it. The idea was simple. If you were struggling financially, you could count on Medicaid to help you get the care you needed. Medicaid was simple. If you were poor, you got help. There were no complicated hoops to jump through, no endless forms to fill out, and no need to prove you were working a certain number of hours each week. The focus was on health, not on policing people's lives. States set income limits, usually around 138% of the federal poverty line, and that was it. If your income was below that threshold, you qualified. It didn't matter if you were working, between jobs, or caring for a family member at home. There was no paperwork gauntlet, no employment checks, and no need to prove your worthiness beyond your financial need. The process was designed to be accessible, not intimidating. The logic was clear. Health and poverty are deeply linked, and Medicaid was about health, not work. The program recognized that illness and poverty often go hand in hand, and that helping people stay healthy was good for everyone. The Affordable Care Act expanded Medicaid to cover more low-income adults, including those without kids. This was a major shift, opening the door for millions who had previously fallen through the cracks, young adults, people between jobs, and those in low-wage work without benefits. Millions gained coverage, and eligibility was based on income, not job status. For the first time, many Americans could access healthcare without worrying about whether their work situation would disqualify them. But then came a shift. The Trump administration made work a central question. Suddenly, the conversation changed from, how do we help people stay healthy, to, are people working hard enough to deserve help? Suddenly, it wasn't just, are you poor, but, are you poor and working hard enough? New rules required people to prove they were employed or searching for work, adding layers of bureaucracy and confusion. This injected moral judgment into Medicaid, turning it from a health program into a tool for social engineering. The focus shifted from care to compliance, and the system became more about monitoring behavior than meeting needs. The result? A system less about care, more about compliance. People who needed help the most were now at risk of losing coverage simply because they couldn't keep up with the new requirements. The safety net became a test. Instead of catching people when they fell, it started to let more and more slip through the cracks, and the consequences were profound. Families faced impossible choices between healthcare and other essentials, and the promise of Medicaid as a true safety net began to fade for many Americans. How did Medicaid shift from income-based to work-based? Enter the Section 1115 waiver. These waivers let states experiment with Medicaid rules, originally to improve care. Under Trump, waivers became a tool to require work for coverage. The rationale work requirements would promote self-sufficiency, but most Medicaid recipients who can work already do, often in unstable, low-wage jobs. Those who don't are usually sick, disabled, or caring for family. This wasn't just a few states experimenting, it was a coordinated push to redefine Medicaid. The debate shifted from, how do we help the poor, to, do the poor deserve help if they're not working? And that's how work became the price of healthcare. If you have to work for healthcare, what counts? The new law says able-bodied adults must log 80 hours a month, about 20 hours a week, of community engagement. That includes jobs, volunteering, job training, or school. Gig work or fluctuating income? You'll need to prove you earn enough, adding paperwork. But it's not just about doing the work, it's about reporting it every month. Miss a deadline or make a mistake, you could lose coverage. The system creates hurdles that trip up even those who qualify. There are exemptions, on paper at least. Pregnant women, people with disabilities, and primary caregivers are excused from work requirements, but proving you're exempt can be a bureaucratic nightmare, especially for those with less obvious health issues. Caregivers for young children or disabled dependents are also exempt, but the rules are narrow. Many people fall through the cracks, forced to meet requirements they can't handle. The system draws hard lines around messy lives, leaving many at risk of losing care. States like Arkansas and Georgia tested work requirements first, and the results were disastrous. In Arkansas, 18,000 people lost coverage in months, not because they weren't working, but because of confusing online reporting. Most didn't even know about the new rules until they lost insurance. Georgia's program was even stricter, requiring proof of work before enrollment. The state spent more on bureaucracy than on actual health care. These experiments didn't boost employment or reduce poverty, they just created confusion, paperwork, and coverage losses. People were punished for being poor, lacking internet, or missing a form. The evidence was clear. Work requirements don't help, they hurt. The lesson? Bureaucracy, not laziness, is the real barrier. And yet these failures became the model for national policy. In 2025, the Trump administration enacted a sweeping new law that would fundamentally reshape the nation's healthcare safety net. This legislation, known as the One Big Beautiful Bill Act, made work requirements a federal mandate for Medicaid eligibility, marking a dramatic shift in how millions of Americans access health coverage. Under this act, adults aged 19 to 64 who receive Medicaid must now complete at least 80 hours each month of work, job training, or other approved activities. This includes not just traditional employment, but also volunteering or participating in certain educational programs. For many, this means navigating new bureaucratic hurdles just to keep their health insurance. The law hits hardest in states that expanded Medicaid under the Affordable Care Act, where millions gained coverage over the past decade. Ironically, states that never expanded Medicaid are largely unaffected, creating a patchwork of winners and losers across the country. The requirements are far stricter than any previous state waivers. Now, eligibility checks happen twice a year, and recipients must provide regular proof of their work or activities. Missing paperwork or a single reporting error could mean losing coverage. And if you lose Medicaid for not meeting these requirements, you're not just left uninsured. The law also bars you from buying subsidized ACA marketplace plans for a period of time, closing off another crucial path to coverage. According to the Congressional Budget Office, nearly 5 million people are projected to lose their health insurance by 2034 as a direct result of these new rules. When combined with other changes in the law, the total number of uninsured could swell by 12 million, reversing years of progress in expanding access to care. The so-called savings from this legislation don't come from making the system more efficient or reducing costs. They come from cutting people off from coverage, often for reasons as simple as missing a deadline or misunderstanding the paperwork. The result? The safety net that once protected millions is shrinking, and for many the ladder out of poverty and poor health is simply gone. The consequences will ripple through families and communities for years to come. This isn't just another policy tweak, it's a seismic shift in who gets care in America. Hospitals and clinics are bracing for a surge in uninsured patients, while those most in need face new barriers to even basic medical services. The impact of the One Big Beautiful Bill Act will echo for decades, affecting not just today's families but future generations. The uncertainty and anxiety it creates will linger long after the headlines fade. In the end, it's the most vulnerable, seniors, people with disabilities, and low-income families, who will pay the highest price as the promise of health care for all slips further out of reach. The real barrier isn't work, it's paperwork. To keep Medicaid, you must document every hour, every month, and submit it perfectly on time. Miss a deadline, lose internet, or make a mistake, you lose coverage. For many, it's an impossible administrative burden. States must build massive new systems to track millions of people, costing a fortune. The result, a bureaucracy designed to make access harder, not easier. Critics say the cruelty is the point, the paperwork is the weapon. The law isn't enforced by jobs but by forms and deadlines. The goal: reduce enrollment by making the process unbearable. The safety net is being quietly dismantled, one missed form at a time. So where does this leave us? Supporters say work requirements save money and encourage self-sufficiency. Critics, doctors, advocates, public health experts say the evidence shows otherwise. State experiments led to massive coverage losses, not more jobs. Most Medicaid recipients already work or can't due to illness or caregiving. The real result: people delay care, get sicker, and hospitals, especially rural ones, face financial crisis. A $50 billion fund tries to soften the blow, but it's not enough. This law is a choice. Is healthcare a right or a privilege earned by labor? Medicaid is now a work enforcement program, not just a health program. The focus is on paperwork, not people. The outcome: a sicker, poorer population, all for the sake of personal responsibility. And that's the bitter reality we're left with.